Thinking about going to medical school? Well, only go to medical school if all the following that I'm about to discuss are true for you. Welcome to my channel. My name is Katie. I'm a medical doctor, and on this channel I seek to empower, educate and promote well-being. So this video is really targeted at people who are considering going into medicine, young or a little bit older. If you're going into studying medicine a little bit later on in life, please consider the following. So, being number one, if being rich and financially comfortable is not of utmost importance to you, then I would say that is a very important mindset to have, and I think that you are a good candidate to being trained as a doctor. Number two, if you are stimulated by lifelong learning, you enjoy doing exams and going from one exam to the next, and that sort of conveyor belt type of profession where there's a constant strive to move to the next level, and that doesn't bother you. In fact, you get excited by it and you enjoy doing exams, assessments and things like that, and you don't mind doing that for the next 10 years to come. That's in addition to going to medical school. After you complete medical school, you don't mind seeing yourself doing all that learning and studying 10, 12 years after you qualify as a doctor, then that is again a plus, and that will be important, something that you will need if you decide to go into medicine. And so this is number three, if you have sat down and considered all your options, and please do not go to medical school if you've not done this, sat down and you've done a genuine brainstorm of all the other things that you could be, all the other things that you could do. Don't go to medical school just because that was a desire that you had when you were a child and you told everyone you wanted to be a doctor, and now that you're of age, you still have a desire, but you feel that you should just go along with the flow. Please don't go to medical school unless you've sat down and you've done a brainstorm. And after doing that brainstorm, considering the pros and the cons of all the other careers that you could pursue, if after doing that you still only see yourself as doing that one thing, and that's being a doctor, and your pros list is massive as it relates to being a doctor, that is something that you need to keep with you. You need to keep that brainstorming, because when it gets tough at medical school and once you're done with your academic training, you can always go back to that list and remind yourself, these are the reasons why you saw yourself doing nothing else but being a doctor. And please, as you brainstorm, I will really encourage you to go to someone who's already a doctor and ask him or her to help you consider that list that you've made. And is there anything that you have overlooked? Is there anything that you should be considering that you haven't considered on that list? If you don't have, because not everybody does, right? If you don't have a doctor that you have easy access to, go to someone who's a professional and who's gone through some type of training, and ask them to help you review that list, and in their experience, is there anything that you've missed out on that brainstorm list that you've made? The other thing that would make you an amazing candidate for medical school is if you don't mind sacrificing your comfort, happiness, and sometimes, very often, your own well-being to pursue this career that you desire so much, to become this doctor that you see yourself not being able to do anything else but being that doctor. And you are happy to make those sacrifices, and sometimes that will include lots of tears, lots of saying, I can't go to that outing, I can't go to that family event, I cannot socialize, or for those of us who have had to fund our own way to medical school, it sometimes means that you cannot buy the latest trend, you cannot buy the latest clothing, because you have, your priority is your books, your food and accommodation, right? So you cannot look the part. So especially in your 20s and in your 30s, when everyone is looking hip and everyone's doing all the fun things, you might not be able to do that up until right into your 30s, when you have, if you're wise with your money, wise in your ways, up until you've completed your training and you've stepped into being a specialist, where you have enough funding, you have more time on your hands to be able to do that. And so if you can sacrifice all these years being disciplined and knowing that some things that is considered fun, you just will not be able to do, then that also is an important mindset to have if you're going to be a doctor. The next point is knowing that when you come out as this very hard worked junior doctor with all the knowledge that you have after doing your medical finals and those OSCEs, and you have the skills and you're ready to go and you're ready to treat all of your patients with this amazing knowledge that you have and all these wonderful skills that you have as a junior doctor, is to know that you will have to take instructions. You will be at the bottom of the hierarchy. You will have to humble yourself and be shouted at by, shouted at is not appropriate. No person, no doctor, no one in the workforce should be shouted at or even bullied. But I mean, told off, because it will happen. It will happen, where the nurses will tell you what to do and order you around. And that's the honest truth. The nurses, your seniors in the medical field, those who qualified a couple of years before you, if you consider yourself as someone who can be told what to do and you're okay with that, and you're okay with the fact that, you know, sometimes those corrections will be painful, sometimes you will cry, sometimes you will have groups of people having an opinion about your ability to do what you're doing. If you are okay with the fact that you will regularly have what sometimes is termed as an appraisal, and your practice will be scrutinized, and you probably will be sometimes told that you're not the best junior doctor, or you're not the best trainee, you're not academic enough, and you can take that and you can dust yourself off and you can get up and try again, and not sink in. Of course, very often it's going to be painful, very often it's going to be very challenging, very hurtful. There's some days where you're going to get up and think, why am I doing this? That is guaranteed. But if you know that now, being armed with that information, and I'm not saying if this happens, this will happen. It will definitely happen. Now, knowing that this will happen, and you can confidently say, I can take it, and I will be mature enough to learn from those experiences, dust myself off, and continue and forge on, forge forward, in order to achieve that status of being that surgeon or that anaesthetist or that medical, clinical lead in general medicine, that rheumatologist, whatever it is that you want to be, that general practitioner, whatever it is that you want to be, if you can take that, and that is the price that you have to pay in order to get that, to get there, and you accept it, then you are the perfect candidate for going to medical school. So remember, when you are making a decision as to whether you are doctor material, you are a medic material, please make sure you consider all of these points that I've just discussed. And if you can put a tick across along each and every single point I've discussed, please go to medical school. The world is waiting for an amazing doctor like you. So please do not delay. Put your application forward and do the work that you need to do to be accepted at medical school.